Hi, Dr. Greenberg. Thank you so much for coming on our show today. We met you in Canada when we met your lovely wife, Robin, while we were all summiting and doing the 29029 Everesting. And that was so lovely that you came to support your wife. And she told us about your work and how you worked in PRP and stem cell therapy and all these cool, innovative treatments that we have never discussed about on our show. So we thought it would be so cool to have you come on our show. And it's a topic that we're really fascinated about and super excited to learn more. So thank you for coming today.
Well, thank you so much for having me. And obviously, kudos to you as well for your accomplishments. And, I got to do a few of the hikes with Robin. And, it really takes a lot of willpower to get up that mountain 15 times or whatever it was and accomplish your goals, which is, what life's about, seeking something and accomplishing it and putting forth your best effort. So compliments both of you.
Well, thank you. Thank you. Thank you. And so one question we love to ask before we get started is if you had no constraints, time constraints, money constraints, how would you spend your day today?
So, that's a really good question. And, I often kind of, ask my patients, especially ones that are retired, like what they're doing with their lives and things like that. And, sometimes they're, working on boards and different types of things, but other times they're just kind of passing the time. And I really think, like for myself, being a healer, that would I rather like play golf or fix a patient that has some kind of chronic issue or something that's going wrong with them, and what's more rewarding to me? And I think the answer is kind of obvious. And for that reason, I'm hoping, because, like they say, man plans and God laughs, but I'm hoping that I can work forever and, help as many people as possible. So, with that, I think if money was no object, maybe I would be like surfing in the morning somewhere really great, and then flying in here and taking care of my patients and having dinner and going home and, walking my dogs and doing all that good stuff. So maybe if I could surf a little bit, yeah, that would be wonderful. But I guess you have to have the right place to go. So, but I guess if money was really no object, I would just build a surf pool here in Pennsylvania. And then I could easily surf in the morning and then just go to my office and then work all day long. So
nice.
That's what I would be doing.
Clearly, you're very passionate about your work.
Yes. Yes. I mean, listen, when you transform lives, there's nothing more, important for the patient and rewarding to me. So it's really a blessing for me to be able to do what I do.
Yeah. I mean, it's wonderful that you're living, like you're already doing what you want to be doing every day, aside from this, maybe.
Yeah.
So maybe this is a good time to kind of pivot and dive in. And can you share, Dr. Greenberg, just maybe a few of the pivotal moments that led you on this path to specialize in regenerative medicine?
So that's a great question. And, I think with a lot of people who are in more of a holistic field, or maybe took a different path, a lot of our stories are quite personal. And with me, I first wanted to be a doctor when I was a child because my grandmother had macular degeneration and she was legally blind. And, she and I were extremely close. So I would take her to the supermarket, help her get her groceries. I would drive her places when I was able to drive. And even when I was in medical school, I was in medical school in Philadelphia where we lived, and I was able to go home and take her to the grocery store and get her seltzer and tuna fish and everything else so she could eat and live. And, this is what I wanted to do as a doctor, is to treat people who are blind. And, I thought a doctor was a person who could fix problems. So I figured I would just figure out a cure for blindness and go along my merry way. Nevertheless, I was 18 years old and I was working for my father in Philadelphia, and I was driving somewhere to take a tractor trailer home, and a drunk driver hit me at about 75 miles an hour.
Oh, wow.
And I was going about 5 miles an hour in my mom's car, and I came within a few feet of probably not being here on Earth. So it was a really bad accident. The whole front of the car was up in my face. The car was turned sideways, and I just really don't know how I survived. And fortunately, I'd always had worked out and tried to stay strong and things like that. So I think that really made me a little more resilient to this accident, to where, my head smashed into what's called the A pillar of the car, which is the pillar between the windshield and the side window.
Oh, wow.
And, after that, I did 9 months of physical therapy. I saw different orthopedic surgeons, and, people kind of look at you with three heads, especially when you continue and you have pain and they don't know why and they don't really seem to take an interest. And this is what my experience was. So, nevertheless, after doing therapy for 9 months, I was kind of in the same place. And I always felt after that my shoulders were implanted into my ears. And I was always kind of tight. But what developed were these crushing headaches. And the headaches would come on at different times and would feel like someone was taking an enormous drill bit and trying to put it through my skull on the right side.
Oof.
And interestingly enough, I never had it on the left side. And it got to the point to where it would wake me up out of my sleep. And I even remember one time after, I think it was after my second year of medical school, that after my finals, one of my roommates said to me, he's like, come on. He's like, let's go out. Let's go celebrate. You never want to go out. You're such a party pooper. And I said to him, I'm like, listen, you just don't understand. I said, it feels like someone is taking a vice and squeezing my brains out. I'm like, I need to go home and I need to get under the sheets and I need to pass out and I can't function. And it was really kind of a miracle that I even made it through college and made it into medical school and through medical school like this, because my concentration just was out the wazoo. And, this accident crushed it. And, I was always working so hard in order to try to achieve my goals of being a doctor and getting through medical school, which, as you probably know, the volume of information that you need to learn as a physician is unbelievable.
Mm-hmm.
And couple that with a head injury, and it almost becomes impossible. But somehow I made it through. And I used to go to the doctor of student health all the time at my medical school, and they would just offer me pain medicine or this or that, and not really much of an explanation as to why I hurt all the time. And I was even so desperate that I convinced them in my third year of medical school to let me go to the ENT. I'm like, listen, what if this is all in my sinuses and it's just a sinus pressure? Let me just do anything you can. I'll have my head drilled open, if you can just fix me. And so I went and had sinus surgery. And, like I said, I love surfing. And unfortunately, now my face fills up with fluid from the sinus surgery when I go surfing, but such is life. So nevertheless, I tried to do ophthalmology to be a retinal surgeon. And I looked through the ophthalmoscope into the patient's eyes, and I literally couldn't see. And the ophthalmologist really had no idea who I was working with. He had no idea why I couldn't see into someone's eye, because they've never seen that before ever.
Wow.
And the ironic thing is that, even though he told me I'll never be a retinal surgeon, I take care of his joints and fix them up when he needs so. Life comes full circle. So anyway, so I couldn't be a retinal surgeon, and I was always much more into, nutrition and exercise and working out and staying as healthy as possible. And what I saw in medical school was kind of the opposite of that. It's people were sick, they kind of stayed sick. No one really did a lot to really influence their disease. And they were kind of in this revolving door of in and out of the hospital. And one thing that just never made sense to me, there was a person who, on the surgery rotation, we amputated their toes. And what they got later that night for dinner was mashed potatoes and white bread and juice, and nothing that made sense whatsoever. Mm-hmm. And I'm like, this is just preposterous, and I'm going to really participate in this system. And, on my next surgical rotation, we ended up cutting off his leg, and nothing was ever done to really change his course of disease. So this isn't a system that I really wanted to participate in. And instead of obviously being a retinal surgeon, I was more interested in holistic medicine. And fortunately, here in Philadelphia, there was a center in Jefferson that I'm still affiliated with that was more holistic in nature. And I learned a lot from the doctors there. And I just kept on reading and studying on my own about vitamins and nutrition and different types of testing and different things to look into. And often we were changing the course of disease rather than just managing it. And this was more interesting to me and more in my philosophy of being a doctor to fix something. But time went on and my headaches continued, and I eventually finished my residency. So I was 28 years old, which was 10 years after my accident. And I had read something that there was a way to regenerate tissues, heal things. And back then we didn't have internet. So I know I'm probably dating myself, but it is what it is. And I knew that this was legitimate because Dr. Koop, C. Everett Koop, who was the Surgeon General, he had this treatment in the 1960s. So I figured if the Surgeon General is going to have this treatment, then there has to be something legitimate about it. And I did my basic science research and pulled articles and read about it. And I'm like, this sounds really ideal. Now, the nice thing about it, Dr. Koop actually became my patient in the 2000s, and I got to take care of his spine then. So it was really an honor to meet him. And he was really influential in my life, even though he probably didn't know it. So the doctors who had treated him had just been deceased, and they trained another doctor. And I found that doctor and had him teach me. And fortunately, I was always very good with my hands. Probably from playing Legos and things like that when I was younger, and drawing and doing architecture and all kinds of things. But I fortunately had a skill. And a few days go by and it's my usual stuff. I'm up at 3 o'clock in the morning. I feel like someone's drilling through my skull. As I said, I've been going through this for 10 years and there had been no answers. And Robin, my wife, thinks I'm dying of brain cancer. And I'm like, I'm not dying of brain cancer. I had an MRI last year. There's nothing wrong with me. And I thought to myself, well, my pain was always here. And I'm like, what if it's not really all coming from my head? And I started examining my spine, my upper cervical spine and base of my skull. And I'm like, what if this was referred from damage from the accident that never healed? And my right side was really tender. My left side wasn't tender at all. And my headaches were always on my right side. So I thought, maybe this has something to do with it. And quite frankly, after 10 years of suffering and being in horrific pain, you'll pretty much do whatever you need to do in order to get rid of that pain. So what I did was I went to my office, I drove there in the middle of the night, and I started thinking to myself, what can I put together here biochemically that will create a reaction in my tissues that'll force it to heal? So I mixed together a whole bunch of different things, and I very, very carefully injected my cervical joints behind my head, not using mirrors, and the base of my skull. And fortunately, I could, like I said, my hands work really well. I could feel with that needle exactly where it was on each bone and each joint. And went home, obviously woke up in the morning, felt kind of lousy because you're up in the middle of the night. But the next day I was going for a walk in the morning and I'm like, I think I feel a little bit different. But let me ignore this 100% because I don't want to be subject to any placebo effect whatsoever. Right. So I'm going to tune this out of my mind. But each day went on and I started to feel a little bit better and a little bit better and a little bit better. And then the pain would come and go, and then I would treat myself again. And make a long story short, after about 4 months, the pain was completely gone. And it's been away for over 25 years.
Wow.
From that one injection that you gave yourself?
No, I actually had to repeat the procedure several times until all the tissue healed.
Okay.
That's amazing.
So, with that one type of treatment.
That one type of treatment, yes. And, the way that, and the nice thing is, as I went along, I actually developed the treatment that I've used on like many pro athletes and things like that. It was all developed on my own neck because, like I said, I was using my fingers to feel the needle and feel along specific places in different bones that led me to develop the technique that I use to help concussion patients and other people with upper cervical problems.
This is not stem cell therapy, what you're talking about. Is this the Greenberg method?
Well, the Greenberg method is my whole method of evaluation and diagnosis in order to know what to treat. But in patients today, Marnie, we use stem cells and PRP and other thing called V cells, because now that we know also the patients that have concussion and head injury have a higher risk of dementia and can get damaged within their brain. And we use another type of stem cell, which I can talk about, to drive into the brain in order to help with that type of damage, to help prevent injury and help them stay as sharp as possible.
Can I just have you back up for a minute? Because I think a lot of this is very new to our listeners, and your
Yes.
story is so powerful. And I think a lot of people can relate to having unexplained, well, you had explained pain from the car accident, but it lasted for so long, and people just get to the point where they're desperate to do anything. And so,
Right. Well, the thing is, by the way, no one actually related my pain to the car accident until I figured it out 10 years later. Everyone thought your headache was just this
that's
headache
crazy,
thing.
which is,
Yeah.
I
Just some
feel like
headache
today
syndrome.
it would be different because people make those connections more.
Right.
But so can you tell us, like, what is regenerative medicine? Because people may not be familiar with that. And then maybe talk a little bit about, PRP versus stem cell therapy, and just
Sure.
a quick, because we don't want to, we have a lot of things we want to cover. We don't want to run out of time. So like a
Sure.
quick, synopsis.
So, I mean, I think the real biggest generality I can give you about regenerative medicine, it's basically just using some type of way to heal and regenerate tissues. I mean, they're doing it in all different types of ways. I mean, people are growing hearts outside the lab and they could be transplanted into a patient. People are looking at regenerating livers and taking it into the patient. This way they have a normal functioning organ. But much more commonly, I deal with patients that have chronic joint problems, arthritis, sports injuries, horrible back pain, nerve injuries, and things like that. And the crux of it is essentially using different types of things that either trigger the immune system in specific damaged areas, or with things like PRP and stem cells, taking the body's innate ability to heal and filtering out that biochemistry and putting that biochemistry directly into areas of injury to stimulate the rebuilding of that injury. And just like I did for myself, creating a very long lasting, if not permanent, effect of healing.
So, and it's all legal, right? This is all legal.
Well, that's a really good question. And not to be too controversial, but I was listening to one of your podcast guests who was talking about using placental substances and things like that, and placental-based stem cells, and they are not allowed by the FDA. There's very strict regulations about this and exosomes, and a lot of people are giving things they really shouldn't be. And I'm not saying that the people are immoral, but they're being told by different representatives, because I get approached by them all the time. Oh, you should use our umbilical cord product, and you should use our exosomes and everything else. And guess what? I mean, I'm not only do I have my own practice, but I'm part of a hospital system here, and a very good hospital system in the Philadelphia suburbs. And I know that FDA jurisdiction does not allow you to do it. And being part of this hospital, I will not put it in any type of jeopardy doing something that is not completely above board. So the things that we use in our office are what's known as autologous. Autologous means that it comes from the patient and delivered back to the patient. So it's not coming from a source like a placenta. And we've even had questions from patients like, oh, I donated my cord blood for my kid.
Right.
Can
Yeah.
I take that and use that? And can't you inject that into me? And the answer is no. It's not legal to do
Interesting.
so.
Okay.
So when we get stem cells, we're getting them from the patient.
Does that
And
hurt the patient?
so that's a great question, and it depends upon what we are doing. So PRP comes from your blood. It's basically platelets and growth factors that come from the blood that then I go and inject using my Greenberg method into areas in order to heal those areas, to which we can talk about that again, like a more holistic way of approaching things rather than conventional way. But stem cells, it depends upon what you want to do, because we use a certain type of stem cell called a V cell that comes from your blood, that we use a special laser to activate the dormant V cells. And I've been able to show and publish research that if we can inject it into people with something called a radiculopathy, which is like nerve damage that can like run down their arm or leg, that we can actually get that nerve damage to heal within weeks
Wow.
by injecting these V cells into very specific areas and actually fixing the areas around them also. So a V cell is a type of stem cell, and I'm going to talk also about some other applications with the brain because the cells are extremely small. That's what it stands for, very small embryonic-like cell. So they're extremely small, young, healthy stem cells. Even in older individuals, these stem cells are young and powerful. And we activate them, and they can do amazing things because they can pass through the blood-brain barrier, and they can pass through lung tissue to where, like, when people go to Panama and they spend all this money and they get these placental cells, they're not passing through the blood-brain barrier. They just can't. They're too large. So V cells can pass through, and this is how we can help patients with concussion and neurological issues and even certain things like memory loss and their athletic performance, because your production of hormones comes here. That's where the brain signals the body to make hormones. So there's lots and lots of really cool things that we can do with these cells. In fact, I had one of the cases I did yesterday was a young lady who unfortunately has an eating disorder and she hasn't gotten her period back. So we gave her a V cell infusion, and not only did I treat her ovaries to stimulate the ovaries, but we did a whole lot of stimulation to the pituitary gland and the hypothalamus, because that's releasing the signals for you to make your natural hormones.
Okay, this is fascinating. I was going to ask you what kind of conditions you typically will help with. I was not expecting you to talk about hormones in your pituitary gland and activating your ovaries for sure. But I think this is something from a woman's health standpoint and hormonal imbalances that is really fascinating, in addition to obviously the pain and the neurological issues. And
right.
So is this treatment you did yesterday, like how often are you doing this and what have you seen in similar cases? I'm just curious.
So I don't do a lot of patients with amenorrhea just because most of my practice is more regenerative orthopedically based.
Yeah.
But in a few different cases, like I have one of my patients, she tore her ACL and she did not want to have surgery. So we did some reconstruction with stem cells and V cells. And, I know her whole extended family, and I've taken care of her mom and her brother and her uncle. And so I know her history. And she told me that she was having trouble getting pregnant, and it was really very frustrating to her. And I'm like, all right, so while we're V-selling, let's just go over your ovaries, because one of my colleagues, they have done a lot of work with ovarian tissue, and it's been really successful, both with injecting PRP and also using the laser guidance like we use. So I treated her ovaries. Her uncle calls me back like a month later and tells me she's pregnant.
Wow.
Which is really amazing after she struggled for a few years. So I don't specialize in that, but when I can help a patient, I'm just going to throw a little extra magic here and there.
So are most patients coming to you with orthopedic issues where they don't want surgery? And then are you like kind of butting heads with orthopedic surgeons? Are you working with them, or how does that work?
That's a very good question. And most patients are coming with orthopedic issues, although like for the IV V cells, they're usually patients as well that want, that either have orthopedic issues that we have to use an IV treatment on as well, or they have other issues that we're finding out while they're here. They have autoimmune issues, they have different neurological issues, or, I've done any procedure I've done in this office, I've done to myself. And I've done V-cell procedures to myself a few times because the cells actually help to reverse the DNA aging that occurs, and it makes you biologically younger. So
Sign me up.
I know.
There you go.
When can we come? We're going to be on the first flight to Philly.
So in all seriousness, like after I treated myself, which I wanted to obviously protect my brain from my head injury. So I've done my brain several times, and like, thank God I'm like as smart and sharp as I possibly can be. And all that brain fog that I used to have is gone. But I actually gained 7 pounds of muscle from the procedure. And the funny thing is, my patient that I just treated before we joined this podcast, who I had to fix his lower back problems, which weren't going away, we V-celled him a few years ago, and he started hitting all kind of personal records, and he gained 5 pounds of muscle after the procedure. So it's something that we see pretty often in patients. So, but yes, do we work with orthopedic surgeons? Sometimes, but most of my patients come when nothing else has worked, especially for the concussion and spinal problems.
Yeah.
But my patients either have come after nothing's helping them. They've had the epidurals, they've had acupuncture, they've had chiropractic, they don't want a fusion, or some of them have had fusions already and we have to fix them. Other patients don't want rotator cuff surgery or don't want meniscal surgery, or again, they've already had it 2 or 3 times and they're not getting better and they can't use their knee. As these are just common things that we see. And especially in the female population, I see a lot of patients that have hypermobility or Ehlers-Danlos syndrome, and they end up with a lot of times with autonomic dysfunction. And this is really, and I'll try not to get too complicated, but this is really like a technical thing that's so undiagnosed and misunderstood, yet so important. If you have injury to your upper cervical spine, whether you may or may not be aware of it, and the reason why I say may not be aware of it is because your symptoms may not be neck pain and headaches. It might be dizziness, lightheadedness, your heart racing, anxiety, and all those symptoms you could just chalk up like, oh, you're just an anxious person. But when we have patients that have this that go on and it's completely unexplained and they're not getting the answers, we can often see if they have damage in their upper cervical spine. And the reason why this is important is because this damage in this region changes the configuration of the spine and increases the fluid pressure, because we all have cerebrospinal fluid that's flowing through our brain and our spinal cord. When that pressure goes higher and increases the pressure in the brainstem, it creates like an electrical disruption, and it does not allow the nerves to work properly. And if the nerves are not working properly, then you end up with what's called cervicocranial syndrome, which the symptoms could be so varied, but they're all based upon dysfunction in that autonomic nervous system. But they could be problems such as headache, dizziness, trouble tracking objects, blurred vision, like I said, anxiety, tachycardia, digestive problems, can all be coming from the brainstem. And again, it's something that's often very underdiagnosed and not looked at, but I see it all the time in patients. And when you fix it, it's really very rewarding.
So it sounds like there's, the orthopedic type cases where someone is in acute physical pain, but
Right.
you just listed a whole host of other symptoms that are kind of, maybe a little headache here and there, or anxiety. I mean, so many people have anxiety and some of these symptoms, especially in women. So do you do, like, if someone came in to see you with just kind of a host of, I don't want to say smaller issues, but not like this big major
like they didn't
pain.
know
like
what
they didn't know
was
what was,
the
and they've been
problem.
going to acupuncture and doing these things. What type of examination do you do to figure out, could some of these services be helpful?
Sure. Well, a few things. Like, first of all, like when people are coming in here, they're usually coming out of desperation and frustration. So we're not really getting someone that just has like one slight headache or they were dizzy one time. They're having these recurrent problems that just are not getting resolved. And in regards to evaluation, like this is really where my Greenberg method comes into place, because again, like I said, I need to use my hands a lot. For example, like in cervical cranial syndrome, you may look at an MRI of someone's cervical spine, they may be able to see that the diameter between their brainstem and their brain is less than it should be, but that's not necessarily diagnostic. Or you might be able to see that instead of the nice C curve that people are supposed to have, that their spine's very straight. So these are clues, but they're not diagnostic. But I may be able to put my hands on the vertebrae and feel the vertebrae and feel the damage in the joints, which often the patients will feel discomfort in that area that I'm palpating, and I can sense their discomfort. I don't ask them if this hurts or that hurts. I know what hurts because I can feel normal versus abnormal. But in regards to my diagnostic method, it comes down to so much more than that, because everything needs to be in balance. And not only does our lives need to be in balance between work and play and fun and relationships and everything like that, but so does your body. And if, for example, your pelvis is shifted left and then your shoulders shift right, that shift in your shoulders pulls on your cervical spine, and then it'll shift the cervical vertebrae. And then, even though I'm an MD, I do gentle manipulations on patients to reduce these vertebral dysfunctions and put them back in place. Doing that can often give patients immediate relief and also helps to explain what their symptoms are. For example, like if I have a patient that comes in that literally can't track and they're complaining of blurred vision, and it's, maybe they have some of the other symptoms that we discussed, maybe they don't, and it's been unexplained, no one can find out why, and I do some tests and I can see how the patient's eyes are tracking or even following my finger or other basic things like that. And then I can go and often manipulate their shoulder blade back into place, which takes pressure off the spine, and then move the spine back to where it should be. And then all of a sudden they can track everything perfectly. It's from compression on the brainstem.
Wow.
There's no other explanation.
This is so fascinating.
So fascinating.
Yeah, so we've done that over and over and over and over and over again with patients, and typically, 9 times out of 10, we can cure that patient and make their problems go away forever.
So is it a one and done kind of thing, or are they coming back? Like when you go to a chiropractor, for instance, they, want you coming forever.
Yeah, well,
Right?
it's not a forever thing, but it's something that does take time and takes repetition, because the body, especially after chronic injury and things haven't healed, like, I might get patients that have had problems anywhere from 4 months up to 50 years. So I can't heal a patient who's had 50 years of problems, which I have had patients come in after 50 years, that I can make go away in a week. It does take repetition, and we do have to give the body time to heal. And typically, like, we treat the patient once a month until I think that it's enough, until the tissues are healed. For example, another person we met on 29029, I was telling her about the pelvic tilt things that I innovated and all those things. She's like, "Oh, my pelvis is tilted," and
so is mine.
she's like, "Yeah," and she's like, "I need to come see you." So she's like, "I just had this whole thing done. I'm going to send you the results," where they basically did a whole body MRI on her. And I'm like, "Oh, do you realize you have really significant scoliosis?" She's like, "Yeah." She's like, "My back hurts all the time." But she was just kind of being a warrior and going right through it. So she flew in to see me, and it's been about like 4 months, and she's Australian. So she flew back and forth to Australia last week or two and didn't even have a backache. And she's doing all of her activity and everything else. And within 4 months, like, her years and years and years of chronic pain is more or less gone.
Wow.
So, and also by reinforcing the joints that are scoliotic and then putting her through certain exercises, we can eventually over time help to reduce the progression of that scoliosis as well.
Okay, this is amazing. And I feel like you're one doctor. We need replicate you times hundreds and thousands. Where can people, in addition to your practice, and you can share all that, are there a lot of regenerative doctors that are doing what you're doing?
So there are a lot of regenerative doctors out there now. Are they doing what I'm doing with my methodology? No. And, sort of the good and the bad is that when I started doing this over 25 years ago, and I would go to the one academy that basically had some type of regenerative medicine, there were maybe 30 doctors there that would go. And one of my goals in life was to change that. So I was really lucky that I used to get interviewed by the regular television media all the time here in Philadelphia and sometimes nationwide. And one of my pieces about headaches and things like that was on ABC aired in 86 markets across the country. And after that, there were 300 people that came the next year. And because we were getting calls from all around the country, how do I do this? How do I learn? And this and that. So it has spawned tremendously from that TV interview. But I think where things have gone is at least better than what's been done traditionally, because there are people seeking many more regenerative sources. But I think that as more people have gotten into it, they've gotten a little bit away from the art, meaning of learning how to feel and examine and think, and
Mm-hmm.
just being like, okay, well, here's where we see the disc herniated on your MRI. We're going to inject stem cells or fibrin or whatever into this disc, and you're going to be better, which is going to help a subset of people. But I think it shouldn't be done without looking at the whole overall picture. So I like to really look at a patient as a whole and really diagnose them, even from an orthopedic standpoint. Like anyone that comes in with a knee, ankle, back issue, they have a pelvis issue that's
Right.
undiagnosed, that's contributing to it or causative of it. That's kind of the difference, because even I don't care what you take, but let's say someone has a meniscal tear. If you do and inject PRP into the joint and into the meniscus, it may be helpful. Or we did a study where we showed that we could use stem cells from fat and we could actually make the meniscus reheal, which we showed by arthroscopy, which is directly looking at the tear in the meniscus. And 9 months later, we went back and saw the tear all gone from the stem cells that we used, again, from the patient, not from placenta or anything else. But along with that came adding stability to the ligamentous structures, which were weak, which caused the meniscus to tear in the first place.
Mm-hmm.
So that's the difference between like what's going on now in many places, where they're just injecting one place into a joint and hoping that something works, rather than fixing the problem. So I
That's
really prefer to fix the problem as comprehensively as possible. And this is why like I train physicians and students and in my office, and give lectures to the hospital system here, and to Jefferson. I've given lectures to try to expand the knowledge base and have people have a greater understanding of what's done. So, and sometimes talk at national conferences and things like that. But again, I think you have to have the gift in your hands to be able to feel and to want to feel and examine, and not just look at an MRI.
Yeah, I
So,
love that approach. It's really like it's more of a functional medicine, looking at the whole person, not just the one symptom that they have, like you said, the chronic pain in an area.
right.
I mean, Scott, I feel like we're going to have you come back on for a part two. As we start to kind of, unfortunately, have to wrap up this conversation, can you share maybe like with our listeners, are there lifestyle or just movement practices that can help support joint pains or preventing future injuries as a lot of us start to age? And, a lot of us have elderly parents out there, and just practical tips that you could share.
So I think that's a really good question. And I think that, besides doing things like V cells to extend your longevity and things like that, you have to stay mobile and you have to stay strong. And the more a person has their strength, the less likely they'll be to fall and break a bone as they're older in life. Obviously, keeping your coordination about you is a really important thing. It
mm-hmm.
helps you be able to function on your own and not need, a care support system. So that's really important. I think also like things like stretching and yoga are important for balance and also to keep more limber. And what I see specifically, especially with the pelvic tilt of how I discovered the treatment and how I fixed the problem, is what I've realized is that so many people, because of sitting and different activities, that their psoas gets really tight, their IT bands get really tight.
Yep.
So we recommend different stretching protocols, which I have on my website, to loosen the IT band using some type of, even a simple lacrosse ball and some simple stretching. And one thing I think is great, both for the lower and upper body, like in yoga, is Warrior One, because you can stretch your psoas. You can also get your arms back and stretch out your chest. Because the
Mm-hmm.
more that you stretch out your chest, the less your shoulder blade's going to pull and then affect your neck. So if you can keep all those things in balance and exercise, and also not only like exercise to build the front part of your body, but you got to build the back part of your body. Because usually people's
Absolutely.
quads are stronger than their hamstrings and their glutes. So you really need to strengthen those back parts in order to keep it balanced. I think if someone's capable Doing kettlebell swings, if you can do them properly, is a wonderful activity also because it gets your hips unlocked. And like I said, when your hips lock down, throws the pelvis out. So if you can keep that pelvis level, it's monumental in regards to your life and your gait and everything else. And just to give you like another example, and something that I see pretty often is like when we have patients come in, generally they're older, but not always, that have something called spinal stenosis, to where the arthritis of their spine is clamping down on the nerves and they can't walk for more than a few minutes in the severe forms. And just had a patient in yesterday. Again, his pelvis was tilted. He's shuffling around, can't even take a normal step. We injected him in the areas that we do in the spine and hips and sacrum and everywhere else. And then I injected him for tilt, had him stand up. So he basically limped and shuffled in and walked out.
That's
Wow.
Felt
unbelievable.
better.
So
Because correcting that tilt takes
miracle work.
pressure right off the nerve.
I have a question about that. Do you see, when you do that kind of thing, people's flexibility increase?
Over time, yes, because a lot of issues with flexibility is the body protecting itself.
Right.
So when you have people that feel tight all the time, and even if they stretch, they can't get out of this like chronic tightness and stiffness, that's the body protecting itself, because there's some type of subacute joint injury and the body can't heal the joint really well, because if you've ever like done anatomy, like like ligament and tendon tissues are white. They're white because they have very poor blood supply. So you can't deliver the nutrients and the healing factors very well in that area. That's why a guy like me has to go figure out what's wrong and inject those areas. So your body knows like it doesn't want an injury to get worse and worse and worse. So what it does is it contracts your muscles. So you wake up in the morning and you can't get out of bed and you're stiff as can be. That's your muscles trying to protect your body.
It's so interesting.
Yeah.
So how would a person determine if they're a candidate for regenerative medicine? I mean, would you say everybody? I mean, everybody has aches and pains and issues in their bodies, right? Like,
that's correct. And also, I mean, listen, when people are getting cortisone shots, like that's kind of a mask and a Band-Aid and sort of a very generic treatment.
my mom gets so many cortisone shots. I just want to throw that out there, like regularly. It's scary. It's frightening.
Yeah, it's kind of scary. But even if you look at studies that have compared the regular way of doing PRP, which they do it in the same way as a cortisone shot. So even if you compare just those two injections and not even using my methodology, which is much more successful, the PRP still works much better than a cortisone shot or the gel shots.
Interesting.
Yeah, but unfortunately, you're not going to hear a lot of that because, it's still considered alternative. It may not be covered by insurance. The doctors aren't very familiar with it and they may naysay it. So you have all these different factors that are involved. And again, this kind of comes down to the holistic thing. Like you really have to treat the patient and really understand their psyche and their wants and desires and their determination in order to heal that person. It's not just, a simple thing like, oh, here, you have a knee problem, boop, let's just put that right in your knee. You're all good. It doesn't work like that.
Right.
So the simplistic models don't really work.
Yeah.
So you really need to look at the whole person.
So what is the best way for our listeners to like get in touch with you, learn more about this topic? I know you have a documentary coming up, Shield.
Yeah. We're going to be part of Shield, which was produced by the Lollies, and they've done a lot of very interesting productions. I'm going to talk about my story in there. I'm not going to talk about some of my latest innovative work with cancer, but we can always talk about that at a later date. Again, using very functional and sophisticated lasers. But they can look at our website, greenbergregen.com. We have a lot of resources in there. I have some of my old podcasts on there, a lot of my old TV interviews. I have webinars. I have some of the lectures I've given to hospital systems and all kinds of things like that. And the nice thing about my practice is that when patients come in, they're very well researched. They understand what I am saying to them. And, I really enjoy that because I don't want to really treat a person who doesn't understand what's happening to them and why we're doing certain things. So, and I think with that, I think we get the best rate of success. So,
well, yeah, like you said, by the time people come to you, they've done many other alternative treatments,
right,
more traditional treatments, maybe even surgery. So
right.
they're well versed in what's going on, right?
Well, and
That's
I think
correct.
one thing a lot of our listeners are probably wondering is, do you even take insurance?
Yeah,
I mean, unfortunately, I never have and probably never will. You know, it's kind of a sad thing because in my mind, like this should completely be standard of care.
Yeah.
Right.
And because it works so well, and it's been, I mean, some of the studies show that, you know, this is like for people with like chronic pain, this is like 85 to 90% effective. And even when they've gone back in studies 8 years later and looked at these patients, the majority of the patients are still doing really well. Now, those numbers trump any type of traditional treatment out there by crazy amounts. And I'm living proof of that. I mean, I'm 25 years out and I go hard between my surfing and skiing and snowboarding and boxing and mountain biking and everything. I go at it every day. And, you know, how would I be able to do that if my joints weren't repaired? It wouldn't happen.
No.
So I think this should be standard of care. And I've petitioned at different times to insurance companies and things like that to get this approved. And unfortunately, the political forces against it are too great. And just to circle back, and, you know, I'm going to tell a story that was told to me directly by Dr. Koob. So this is no whisper down the lane. So I said to Dr. Koob, I'm like, listen, I'm like, you're the Surgeon General. You sit on the board of Medicare, and you know how well this works. And like, why can't you get this approved? Because like, why did I have to go and live 10 years feeling like someone's taking a stake through my head? And he said to me, he's like, listen, he's like, just so you know, he's like, I went before the board of which he sat on. I presented the research. I talked about my own personal story of how much this helped me. And we took a vote. And everyone voted no, but him.
Wow. That's
And
crazy.
it's crazy. And here's the kicker. So he said to him, you know, I presented all these things. And he was a very intelligent man and a very kind man and very calm person. And he asked them, he's like, why did you vote no? And they said that if things like this were approved, that the traditional system would collapse because there would be no need for it. So instead, you and I are left in a system that's way too expensive and way too ineffective.
And it's not helping people at the end of the day.
It's not helping
so many
people.
people that are suffering, that are in chronic pain, and we are spending a lot of I'm not going to even go off on a rant right now, but this is really disappointing. I mean, it's amazing. And so you are bringing so much hope to people. And then to turn around and have to say, sorry, these procedures that over a course of maybe 5 or 6 months or a year could totally transform your life, and you'd be able to work and contribute more to society because you're in good physical condition. Sorry, it's not covered.
Yeah.
A lot of people, this will be a deal breaker for them, right?
It's absolutely terrible. It's absolutely terrible. And this is why, like, I mean, you know, I like to give back. Fortunately, my wife and I were very charitable people. But one of the things that I do is to volunteer for my local police department here. And when the officers are injured and disabled or have different types of orthopedic problems, I told the sergeant, send them my way. And this way they get treated at no cost. All of my guys that I've treated, I'm sorry to say guys because they've all been men so far, but all of them have come off disability and are all still working.
Amazing.
So, and police officers take a beating.
Yes. Yeah. And they're helping the communities, like these are people that are giving back every single day. So
right.
Thank you for doing that for your community in Philly.
Yes.
Okay. Well, Scott, you'll definitely be coming back on for a part 2 at some point.
Yeah, we got to talk about the cancer stuff, which is just a whole other realm.
Right.
So,
and we'll link all your contact information up in the show notes. And go ahead.
Oh, okay. One final question that we love asking all of our guests is, what does the art of living well mean to you?
For me, the art of living well means quite simply like going at it at 110% no matter what you do. And, whether it's in your studies or your career pursuits or in your relationships or in your sports, it's giving it your all at all times and making the best of everything, which isn't easy to do because life throws a lot of curveballs at all of us.
Yeah.
And, you got to be able to deal with those curveballs, which, are sometimes really, really difficult to deal with and can be really tolling on the body, on the mind. And, it really takes, a lot to get through those types of things. But when you can give it your all, give it your all.
Absolutely love that.
Yeah.
Great advice.
You're clearly doing that and have just through everything you've persevered through your life. So
I try my best. I mean, I might not always be successful, but I'm always trying.
Well, thank you so much for coming on our show today. We've really enjoyed this conversation. It's been like my mind is spinning.
I know. Yes.
Well, thank you so much for having me. And, thank you. I really appreciate you sharing the information.
Yeah, of course. Have a wonderful day.
Have a great day.
All right. Thank you very much. Take care. You too.
Bye-bye.
Bye.